Hi everyone, Lon here from October Health. Very excited to have Dr. Sidupe with me, who's the Chief Medical Officer of the De Beers Group. Diamonds are a woman's best friend.
Absolutely.
Really excited to have you here.
Thank you for having me.
Yeah, diamonds are forever. And yeah, I think one of the most enduring brands in the world and one of the most looked up to. So thanks so much for being here.
Thank you very much for having me.
Awesome. So I'd love to kick these off just with a bit of an introduction, if you don't mind. Obviously today you're the Chief Medical Officer at the De Beers Group, but a bit of background, around your career and your experience.
Awesome. Thank you very much. I'm the Group Principal for Occupational Medicine and Wellness for the De Beers Group. From a background perspective, trained as a medical doctor. And I've gone through the motions, have worked in the public sector for a number of years and gained experience there. And I'm very, very grateful for the experience that I got from the public sector. And later on, I was introduced to mining through our sister business unit called Anglo American Platinum. And that's where I got extensive operational experience working for one of the biggest operations called Amandelbult, which boasts then 11,000 employees and about 14,000 contractors and looking after around 5,000 to 8,000 lives in terms of family members. So that's an operation that gave me a wonderful opportunity to sort of craft an understanding around mining and mining health. Together with understanding the communities in and around our operations. Later on, I moved into a more strategic role for the De Beers Group, looking after the global health of the De Beers organization. So that's where I find myself today. Thanks.
Awesome. So wide range of experience there.
Yeah.
And, I think everything that you've done has really set you up for success in what you're doing today. I think what will be interesting, what I'd love to unpack with you is, how do you roll out programs at scale? Because, De Beers, thousands and thousands of lives, communities impacted. But in addition to that, you've got a diverse range of employee as well.
Look, I think De Beers is a bit of an exciting but equally challenging environment. We currently exist in, I think, 22 countries. With no less than 14 to 15 jurisdictions in terms of law. So presents quite a challenge in how do you craft the North Star in terms of guiding at a strategic level, at a policy level. But I think the best approach that we took to in terms of how do we then craft programs that are meaningful, that add value, is to understand how do we protect value from a health perspective, but as well, how do we create value for the organization? How do we see ourselves not just as those who are managing the risk related to health, but how do we as well look at value creation? How do we make sure that we distinguish the organization from its competitors? Why is the De Beers Diamond much more appealing? How does it contribute to the health of its employees? How does it contribute to the health of the overall communities where we exist? So that helps us niche it beyond just mitigating risk, but to value creation as well, and distinguishing the organization as a caring organization, as an organization that impacts its communities in a positive way. Practical implementation really looks at your typical, how do you design frameworks that organizations will be able to translate that strategy into meaningful, implementable plans, and you work together with the various parts of the business to make sure that we partner at the right level to implement those strategic programs.
Awesome. So it's more than just a tick box exercise. Yeah. You're not doing it because you have to, you're doing it because it's the right thing to do as well.
Absolutely. So, you're dealing with health of people, you're dealing with health of communities. You have to be authentic about it. Authenticity then provides that important ingredient in how people receive your programs, on how people take ownership and internalize the programs, and you then have positioned yourself for a great start and for something that is much more sustainable as opposed to tick box exercises.
Makes sense. And, that is going to, I think over time that authenticity shines through, right? And people know that you're there for the long term, and that's critical for the communities that you work with.
Yeah. Yeah. So, we are hosted by communities in different parts of the world. As I said, we exist in around 22, 23 countries. We have different challenges in those particular communities. So one of the best things that we've ever done was to lower our fences, understand the communities around us, understand the challenges, and look at how do we then have a strategy that touches those communities in such a manner that we will impact their health positively. It's linked to our purpose. It's linked to the purpose of we care. So the BS purpose, or the BS purpose is we care. So it's important that we exist in communities that wake up and feel that our health is in a better space because we have a caring organization next to us.
Yeah, then that's so critical. I think what I'm interested in understanding, you mentioned 22, 23 countries. Is it a one-size-fits-all approach to that, or is it adapted on a country or even kind of location basis within a country?
Oh, the time for blanket approach, one-size-fits-all kind of approach are long gone. Those days are long gone. A meaningful, sustainable program has to be orientated around risk. What is the risk for that particular part of the world, for that particular part of the business? We've got different value chains in DBS. We've got the upstream business that looks at exploring diamonds and ultimately finding them and mining them. That's the upstream part of the business. And we've got the midstream part of the business that is doing sorting and sales. And we've got the downstream business that is much more your brands and consumer market sort of space. So what is good for upstream not necessarily will be something that is applicable to the other part of the value chain. So we are guided fundamentally by risk, but we are as well guided by how do we partner with that part of the business to create value, not limited to employee value proposition, but as well value around our clients, our markets, our communities. How do we partner with the governments where we are hosted to such an extent that from a development perspective as well, we are contributing positively, we are contributing meaningfully towards the development agenda of the countries that are hosting us.
Yeah, that's amazing. And I think, as you say, business critical to succeed. So I think there's a lot that I want to get into. I think the first piece is you've spoken about risk, right? So that immediately makes me think that you obviously take a very data-driven approach to plan implementation and plan effectiveness. So how do you do that?
Yeah, I mean we've gotten to love the term in data we trust, in what we trust. For everything else, give me data. Yeah. So we are an organization that firmly believes in evidence-based approach, leaning significantly on available science and looking at how do we qualitatively but as well quantitatively understand the challenges within our organization and our communities. So we use that to drive the element of data-driven decisions. How do we support our leaders to be in a space where they can take data-driven decisions? So for us, we have moved away from a transactional nature of health to how do we analyze and improve? How do you understand our community at a population level within the organization, but as well at an individual level? How do you continuously use and lean on technology to analyze and improve, in certain instances, real time? You understand the risks, you understand the opportunities, and you are informed by that type of an approach to take decisions that are empowering and that are much more sustainable.
Yeah, that's, I think that real time ability to drive decision making is so powerful.
Yeah, we live in a fast-paced world, and some of the challenges that we're dealing with would require continuously having your finger on the pulse. It's an environment that unfortunately is still challenged with regards to trauma. It might be safety related. We exist in some of the regions where, typically, violence like your gender-based violence is still a challenge, where crime may be a challenge, is how do you then have models that you'll be able to, should you realize an unfortunate incident, you've got well-defined pathways to care that have an automated system to be able to identify the magnitude of the incident. How do you then link people to best outcomes, and how do you then use processes and your various strategies to effectively link them to rehabilitation as soon as possible and reintegrate them to not just the workplace, but society as well, as efficiently and as soon as possible.
So, yeah, I think, again, those are all these kind of business critical elements that you need to think about from a contingency perspective in an organization of your size. I think if we kind of take a step back and think about health, I think something which is unique about the organization is you're very proactive in the way that you kind of address health for your employees in the communities. Yeah. What are some kind of programs that you've implemented that you're proud of?
So other than having been fortunate to be given an opportunity to implement, one came into an environment where I'm a beneficiary to visionary leadership that existed before me. And I'll use the HIV/AIDS journey as an example. In 2001, visionary leadership sitting in one part of our business in Botswana, Debswana, decided that, when everyone else was sort of hesitant around providing treatment to those who were living with HIV, that particular visionary leadership decided and made it policy to implement an HIV disease management program and created a fund, and later on extended the treatment care support to families and beneficiaries. That type of visionary leadership positioned us today to be one of the few organizations that has potentially moved closer to eliminating TB within our upstream business and generally throughout the business. We are a tad bit close to eliminating new cases of HIV. We've gone at some point for 23 months without a single TB case, 24 months without a person moving from being HIV negative to becoming HIV positive. The investment then, the wisdom and the visionary leadership then has positioned us favorably today to achieve some of the global goals that were aimed to be achieved at 2030. We're likely going to achieve them way before 2030. Mm-hmm. But now the beauty of it in terms of embracing communities around you is, how do I achieve the same for our communities? Now, communities where we live in then become beneficiary of that such thought leadership. They become beneficiaries of how do we then implement the same approach, how do we invest in those communities to get them to realize that. And we have seen those communities rapidly approaching and positioned to achieve the likes of SDG 3 goals. So it's how do you then take over from those who have implemented wonderful strategies, continue to improve them, continue to partner, and looking at global strategies as to how do you achieve them, not just within the organization, but in the communities that are in and around you as well.
Yeah, and I mean, so powerful. And I mean, literally, saving lives at a massive, massive scale.
Yeah, absolutely. So we are integral part of societies that are hosting us. So for us, it's important because we are benefiting directly and indirectly. We source labor from those communities, and we believe in the concept of diamonds for good, making sure that our diamonds benefit the communities that are in and around us. It should create a very impactful and compelling proposal to whoever that is to purchase a DBS diamond. Why should I purchase this diamond? This is a diamond that has contributed to an improved HIV picture within the organization, but as well in the communities that are hosting us,
So I just want to take a slight tangent, just because the words that you use, I think, are very intentional, and you speak about the communities that host you, right? How do you build that culture? Because I think, just speaking around, you're part of that community, they're hosting you. and you're their guest in essence, right? I'm sure that's deliberate from an organizational culture perspective.
Absolutely. It requires a culture shift. It requires an organization that views itself as an integral part of society. As I said, our employees, at the end of the day, they go back to those communities. And if we have no interest in actually developing those communities, in actually participating in the upliftment of those communities, we would have negative impact within the organization. Therefore, the sense of, or the terminology, these are communities that are hosting us, are not difficult principles or concepts for the organization, because we know that if we partner at the right level, we know that if we work together with those communities, we then are positioning ourselves to become a thriving organization.
Yeah. And I mean, it's, that enables you to deliver on that, diamond-footed vision as well. Right?
Absolutely. So it's a discretionary item. It's something that one sits and decide, do I need a diamond? We think you do. And we want to make sure that we have a compelling story behind each and every single diamond. We can trace it back to its origin. We can understand the impact of that diamond on not just the society or the communities that are hosting us, but the governments that are partnering with us in making sure that we really pursue and extract this wonderful luxury item, and we channel it towards good.
Yeah, that's amazing. I think you set the example for the industry as a result.
Look, health and safety in its nature is not necessarily there to give you a competitive edge, but we use it quite extensively to make sure that we embed the value proposition of the extractive sector that has been quite challenged in the past number of years. Why is this sector still important? Why do we still require this sector? How do we leverage this sector to contribute to the overall development agenda? But as well, how do we partner? How do we learn from others in as much as they may learn from us? How do we learn from them as well in terms of making sure that we create healthier working environments, we create safer working environments? So in as much as it might give us at an organizational level a distinction, but the bigger goal, the bigger interest is how do we make sure that this sector is a sector that is embraced by the communities that are hosting us and the countries that are hosting us.
Makes sense. In terms of health, I know your portfolio is broader than just physical health. Mental health is also part of your portfolio and the kind of the change and the impact that you look to make. So, what are some programs from a mental health perspective or well-being perspective that you've looked to implement?
I mean, psychological health or mental health is, there are those who still are saying it's an emergent risk. It's a current risk. It's a real risk that is with us. It's a risk and it's an opportunity for some of us that it is still unfortunately poorly understood. If you go and look at the data, I mean, only 33% of those who are struggling or living with mental health challenges are accessing care. So the 67% that is not accessing care, they're somewhere in our workplaces, they're somewhere in quite conflict-riddled relationships, they are somewhere, on the streets. It doesn't augur well for anyone, more so the workplace. So our fundamental approach to mental health is how do we then help build the knowledge and understanding of what mental health is, and how do we empower individuals and organizations to eradicate the stigma, because generally what people don't know, they tend to stigmatize. So we took a leap from our HIV journey, the difficult days when there was still quite a lot of stigma on the HIV space, and we threw science at it, didn't improve. We threw medication at it, it didn't improve. But when we took a whole society approach and we took everyone with us and we built a stronger ground in terms of capacity and capability, people would recall the days of peer educators. So that helped us move and shift the dial. So we're doing the same with mental health. How do we build the knowledge and understanding? How do we strengthen the ground from a brother, sisters, keeper spirit? How do we empower people with identifying those who are not well and link them to help as early as possible? We're not trying to create mini psychologists. We're not trying to create counselors on the ground, but how do we empower people to be able to have the courage and conviction and say, Tsepo, you're not looking well. Let's have a conversation, and doing it so without stigma, and being clear as to how they link an individual to existing help. And while doing that, they help us eradicate the stigma. So for us is create an environment where neurodiversity is actually a plus. Create an environment where people do not hesitate to raise their hand and say, I'm struggling, I require help, and the earlier we link them to help, we get best outcomes.
Yeah, so there's a lot there I want to double down on, but
Yeah.
and you touched on kind of that peer role modeling.
Yeah.
How do you go about doing that? Because, often, you're dealing with, as you said, stigmatized issues, and it's not easier to, once the first person puts up their hand and, can maybe, speak about their own experience, it becomes easier for the second and the third and so on. But that first person is, a difficult, it's harder for them, right? So how do you identify these individuals? How do you set those role models? How do you kind of break down the stigma?
Understanding that leaders tend to have a disproportionate influence to the workforce. So one of the things that we had to do well and do quite early is to craft and articulate leadership commitment. I'm fortunate in that I work for an organization where leaders embrace health, including psychological health. So the first cohort that actually we trained was the board, together with the EXCO, and around what really mental health is. What is the burning platform of mental health? What is the impact at an organizational level? And what are the solutions that we need to be implementing? And as leaders, how they can support us. It makes it quite easy when the leadership commitment is in the right space. The second thing that we had to do is to look at how do we look at collaborative, comprehensive strategies that foster commitment, that foster participation, and that helps us in making sure that we take everyone along. And we then looked at how do we then make sure that we create a safe net, that everyone within the organization understands that should anything happen, there is a net that would catch me. So there is no reason I should hesitate from raising my hand and say I'm struggling. So we are still on that journey in training people to become mental health first aiders, in getting the leadership to support us, in articulating stories with authenticity, in making sure that mental health is kept in the radar. We are driving scorecards wherein we put dashboard in terms of our performance from a mental health perspective. So it is something that becomes an ongoing conversation. It's no longer something that we stigmatize. When our leaders are doing activities called visible felt leadership engagements, in certain instances, they actually touch on mental health. How are you? What prosper you today? What is making it difficult for you to feel your energetic self, and so forth and so on. Then that helps us to have conversations at the right level. But from a data perspective as well, we make sure that we collect enough data, we analyze our data to understand if we're moving in the right direction. The strategies that we've deployed, the programs that we've put on the ground, are they moving us in the right direction? And continuously looking at that return on investment, continuously understanding parts of the business that are negatively impacted, and make sure that we do apply the 80-20 principle and we move everyone along.
Makes sense. And I think something else which I'm picking up is this theme of, leadership, authentic leadership.
Yeah.
Is that something which is actually a leader's KPI, like to, some of these softer factors around the culture that they're creating within the organization?
Oh, absolutely. It's an important ingredient into a success. If you dealing with something as personal, as emotive as health, and you do not have authentic leadership, it makes it quite difficult to drive that message, to get willingness to participate in these programs. Economics of behavior are that people want to belong to something successful. People want to belong to something wonderful. So how do you then leverage on your leadership? How do you then leverage on authentic leadership to make sure that they then move the whole organization? Like I said, I mean, the population approach or a whole population approach is much, much better. Yes, there are instances where we have to sort of dial it down to individuals, dial it down to certain regions, but we have found meaning and purpose in together we do much better. If we collectively embrace the interventions that we've put together, then we find participation, we find ownership at the right level, and we move far better. And it's much more sustainable as opposed to, individualized strategies, tick box exercises, or just the focus on KPIs, but authentic care from leadership. And that disproportionate influence then becomes quite a fantastic tool in our toolkit to move the workforce in the right place.
I think it's so powerful. No, it's a difficult one or a difficult question, but how do you measure that? Because I think, when you don't get it right, maybe you know that you're not getting it right, but it's a softer metric. So how do you know, which leaders are getting that right, and how do you measure that, and which leaders are not getting that right within an organization?
So one of the things that we have taken to as an organization is the concept of visible felt leadership, using that as a tool to get leaders to engage with people on the ground. So leaders would take time once or twice a week where they do those visible felt leadership, and they would provide feedback as well. And it happens across the business, from the guy on the coalface to the executive member of EXCO participating in visible felt leadership. They have a scorecard in terms of visible felt leadership that they do, but we are able to then, from a quality perspective, pick up the messages, pick up the concerns that are surfaced. We are able to understand the theme, understand the challenges, but use that from a lagging indicator perspective, together with the data that we get from our employee assistance program, in terms of do our people utilize? What is the percentage of the organization that is utilizing employee assistance program? You look at important indices like problem case ratio, meaning do our people present in time or do they delay to present? And those who present, how impacted are they? What is the percentage of those who are impacted? And the number of hours committed while at risk. So those are some of the indicators that are quite helpful in understanding whether we are lending the message, meaning that we are liberating the ground. We're liberating people to very early say, I'm not okay, and it's okay not to be okay. I'm linked to care as early as possible before I get severely impacted. And less and less percentage of people are at work while not in the right frame of mind, or while actually experiencing challenge with their mental health challenges. So we measure that. We look at that both at the leading and lagging indicators perspective. It is something that we are moving towards better indices such as psychological safety index. How do we then understand the concept of psychological safety index? How do we build something that is as helpful as that? But overall, if you're looking at health holistically, then how do you understand the health index score of an organization? So I think with emerging data, with emerging technology, with now people putting dashboards that are helpful, we are able to then start gathering that type of data. Then we can have a very clear understanding of the implemented programs. Are they delivering the value? The impact of the leadership commitment, leadership intervention, is it moving us in the right direction? But early on, I can tell you that we're already experiencing that in DPS.
Yeah, I mean, that's so powerful. And, we launched a wellbeing report with Gibbs at our launch. And what was interesting from it, the two factors that influence individual well-being are psychological safety and trust and leadership, where you're not just ticking the box with that EAP in place, you're actually driving those outcomes that matter and move the needle at an individual level within the organization.
Yeah, I mean, I found there's a framework by John McCann. It's about 8 pillars to psychological safety. It's a very practical and helpful approach or contextualization of how you look at psychological safety. I lean more on it, and then in summary, it just helps you understand how important feedback is. You know, feedback is the breakfast for king and queens. How you need to create an environment where people feel free to express themselves. Then you get feedback that is authentic, and how you need to take everyone along in your journey, and how we should actually celebrate and protect diversity within our environment. And in these days where everyone else is super busy, how do you focus your interventions to impact, or move away from boiling the ocean to fewer but impactful things? And how do you then use that type of an approach to practically land something as important as psychological safety? But how do you start measuring it? Because if we don't measure, we wouldn't necessarily know whether we're improving or we are not improving, other than we get incidents.
Yeah, I think so powerful. And I think you're clearly looking at the problem holistically, in a way that also drives sustainable change. So, and clearly driving impact in a way that matters. So, thanks so much for your time and for sharing your insights. I think we've chatted through so much, ranging from practical program that you have in place, the impact that you're driving beyond your employees, but also to the communities that host you, to the importance of creating that environment of psychological safety. So it's more than just ticking the boxes and doing the right thing, right? It's about really creating an environment that truly cares and creates that world where people are comfortable kind of admitting when they need that hand.
Absolutely. I mean, health has become the fourth bottom line. And we want health to be an enabler as opposed to a risk. We want to make sure that we implement programs, solutions that helps define thriving employees, thriving teams, because we know there's absolutely no thriving communities and thriving organization if the employees and teams are not thriving. So our main objective continues to become creating healthier environments so that we can have healthy people who are safe people, who are productive individuals, not limited to the world of work, but even back at home, even in society, they become ambassadors to this important message. So we are where we're quite very deliberate about it, for we know the value that we get from it.
Awesome. So love that. And I love health as the fourth bottom line. So it's a perfect way to end. So thank you so much for joining.
Thank you very much.